Hello again. All right, so we talked about some male medical considerations. So just briefly some female medical considerations just to kind of tie up some loose ends about the female. Um, so the first thing I want to talk about is female genital mutilation or circumcision. So we talked about circumcision in the male, and so there is female circumcision. We tend to use the word genital mutilation now because it's a procedure that has no health benefits. All right, so for women and girls. So we talked about how in male circumcision it's a personal preference, but there is some benefit as far as cleanliness and infection and spread of sexually transmitted diseases. So it does have some health benefits again, but it's not necessary, but it does have some benefits. Whereas in the female, there are no benefits at all. And this is where there is a procedure, usually by another female, a mother, a grandmother, and it's usually somewhere. It's kind of a rite of passage a lot of times by a grandmother or a mother or an aunt that will basically alter or cause injury to the female genitalia. All right. And because there's no medical health reasons, we're going to talk about the different kinds and what the complications and consequences of this are, or is. About 200 million girls and women who are alive today have been cut and undergone what we call is FMG, female genital mutilation, primarily in Africa and the Middle East and Asia. Now, a lot of people will go, "Oh, well, it's a cultural thing." It is cultural. It's not necessarily an Islamic thing. So don't think that this is just Islamic. This happens in cultures of varying religions. So it's not just Islamic. An Islamic practice, and a lot of Islamic countries don't do it. So I've had students go, "Oh, well, that's an Islamic thing." It's not. Some Islams do it, some don't. So you don't have to be a Muslim in order to practice FMG. It's usually carried out just after birth, within the first couple of days or weeks to the age of 1, but it can be performed through the teenage years, all the way up until 13, 14, 15 years old. There's 4 basic types of FMG. The first one is called a clitoridectomy. That's a hard one to say, which is where the clitoris is removed. So they completely cut out the clitoris. And now remember, these are usually done not sterile. This is usually done with a razor blade, not in a hospital. This is just done, being held down with no anesthesia. And so having the clitoris removed would, essentially remove any sexual pleasure that the female might have. These are considered honor cuttings. They're done to reduce the sexuality of the female, to keep them subservient to men so that they're not going out and enjoying sex, basically. So to keep them faithful is the kind of the thought behind it. There's something called excision, which is where they basically remove most of or all of the clitoris and the labia minora. Okay, so they leave the majora, but they cut out the labia minora. So if you've done your female anatomy, you can follow along. Infundibulation is where they actually take the vaginal opening and kind of sew it back together, so make it smaller. So again, this will prevent sexual intercourse. So they may seal the labia minora, kind of sew that together. With stitching, they may or may not remove the clitoris, but they just make the vaginal opening really small, leave it just open enough so that urine and menstrual flow can occur, but no insertion of the penis, no coitus. There's other kinds of genital mutilation, just kind of, there's called pricking, piercing, incising, scraping, cauterizing, so just all kind of physical damage to the area. And kind of, again, these are going to depend on, where you are, what part of the world, and what the cultural practice is. One thing about the infundibulation, if you undergo that, the female has to usually undergo another surgery called deinfibulation. So that you can reopen that vaginal opening. This will be done right before marriage, so that intercourse can occur. May have to be done several times, widening that birth canal, so the vaginal opening, so that childbirth can occur. So with this type 3, it can occur. Several surgeries may have to occur afterwards. Lots of consequences. There's both immediate and long-term consequences of FMG. Obviously, it's going to hurt. Again, usually not done in a hospital, no anesthesia. Lots of bleeding. This is a very vascular part of the body, and so lots of bleeding, lots of swelling, can have fever due to infection. Tetanus is common because these are just old razor blades. It can cause urinary problems. You have scar tissue forming over the urinary opening, and then also infection. Healing of wound healing problems. Again, these are not in areas with good medical care, so infections tend to result in shock and death. So if you don't get treated, it can actually kill you. And then just general injury to the surrounding tissues. So it's can be very traumatic. Long-term problems. I'm just going to kind of put all these three together: urinary problems, vaginal problems, menstrual problems, sexual problems. So think about all the scar tissue that's been formed. Again, urinary, the clitoris is right above the urinary opening, so that can be scar tissue, and so that can lead to difficulty voiding the bladder. That area can be kind of closed off. Vaginal problems, painful intercourse, menstrual problems, maybe the inability for the menstrual flow to flow freely. Sexual problems with the clitoris gone, and maybe the labia minora and majora sewn together. It's going to make painful intercourse. Increased childbirth complications. This area, because the scar tissue is not as pliable and stretchy as it needs to be. Again, maybe more surgery later on. And then psychological problems. These are done, again, young girls before they have made a decision to have this done. It can lead to depression, lack of sex drive, anxiety. Again, if sex is going to be painful for you, if urination is painful, if all the things that you do naturally are painful, that's going to cause, even PTSD, post-traumatic stress disorder, low self-esteem, low sex drive. So all of these are long-term consequences of FMG. So the World Health Organization considers it a human rights issue, and so they are trying very hard to stop this practice around the world. So again, if you're from one of these foreign countries, you may have some insight into that, and I would love to hear what you have to say about it. All right, so the next thing is menarche, and I put this in here. So this is that first period. So if you see that word, I want to make sure that you know what menarche is. That's your first menstrual cycle. So the first menstrual bleeding. So it's a big deal from both your social and medical perspective. In some cultures, you've become a woman, so there's a celebration. It's can be a seminal central event in the female puberty. It's also a good. It's important medically because this means you're fertile. This means you can have a baby. So once you've hit menarche, then you are in your fertile period of your life. So this is going to be the onset of puberty. You'll start to see all your secondary sex characteristics appear, and again, you're now fertile. The average onset is around 12 and a half years, and it's a little lower in the U.S. Than around in Western cultures. Maybe due to nutrition. There's a lot of thought that increased nutrition has played a role in decreasing the age of menarche. So the opposite of that would be menopause. And so this is when you no longer have a period. And this is going to happen when you haven't had a period for an entire year. And this can take 3 or 4 years to actually become menopausal. So a lot of women are going through the change. So they may have, a period and go a couple of months, have another period, go a couple of months, have another period, and then finally it's every 6 months, and then finally a year. And so you've reached menopause. And that's going to be somewhere in your 50s. There's not an equivalent in males. Males are fertile, throughout their life. They don't have that, whereas females do go through this change. And it's due to a declining in estrogen levels. The ovaries are starting to slow down. You're going to see the reproductive organs and breasts are going to start to atrophy or kind of reduce in size. There's irritability and depression because estrogen plays a role in the female mindset. It can cause hot flashes. It can cause thinning of skin and bone loss. It can also cause your blood cholesterol to go up. And so estrogen is real protective in women. It protects our heart, protects our well-being. So when we start to lose those estrogen levels, again, we can start to see some of our risk factors that we didn't have before, like heart attack and stroke, start to go up as we reach menopause. There is some treatment you can give women, an estrogen progesterone hormonal supplements. And usually this was done pretty commonly, and you could stay on these things forever. But now we've realized that actually we're seeing increases in heart disease and cancer and stroke and dementia if you're on long-term hormone replacement therapy. So it's called HRT, hormone replacement therapy. So generally, you may want to take it for a couple of months or years until you kind of, regulate and get used to being on menopause. So it's not typically the long-term hormone replacement therapy is not typically done anymore. Usually it's more of a short-term thing. You may have heard someone that's taking Premarin. That's a very common HRT that people have. I think it's kind of cool because what that stands for is Premarin. It stands for pregnant mare horse, mare as in a female horse, urine, pregnant mare's urine. So they take the pregnant mare's urine, spin that down, and isolate out the hormones, and then put it in a pill so that you can take it as a HRT. All right. So again, usually you just take the smallest amount of HRT for the shortest amount of time to get over those hot flashes and kind of get through the change. Obviously with women, pregnancy and fertility are huge issues, and so infertility can be very frustrating for women, and there's no just one set cause for infertility. It's a very many reasons that people can be infertile, some treatable, some not. Things like hormonal imbalances, hormones like thyroid. You may actually find out that you're hypothyroid or hyperthyroid, and that may be a reason that you're not able to get pregnant. A lot of people find out they have other issues when they're trying to get pregnant. They realize there's something else going on, and you get that problem fixed, and then sometimes you become pregnant. Endometriosis, which is endometrial tissue that's out in the pelvic cavity, can cause scarring, can cause blockage of the uterine tubes, can cause a lot of problems. And then just age. As we get older, our fertility starts to go down. Having a child in your 40s is more difficult than having a child in your 30s, in your 20s. An ectopic pregnancy is obviously something that you don't want to happen. That's where the oocyte is fertilized outside the uterine tube, and so it attaches outside the uterine tube. So it's going to be kind of outside that reproductive cavity, out in the peritoneal cavity, and usually it's going to abort naturally. It's going to not be viable. It's not going to make it. Sometimes I may have to go in and do something, but it's not going to survive because you don't have the structure there for the fetus to actually survive outside the uterus. PID, which is pelvic inflammatory disease, that can also be a cause of infertility, and this is where you have some kind of infection that spreads outside the reproductive tract into that peritoneal cavity, and again causing scar tissue. So again, lots of reasons to be infertile, but some of them are curable and some of them unfortunately are not. We always have to talk about cancers. That's usually something that in most of our organ systems we mention. So in the female, one of them is cervical cancer. About 500,000, somewhere 450,000 people, women worldwide, will get cervical cancer, and it's deadly. It can be about half of those women will die. And I'm going to have to pause that a second. I'm sorry. Okay, sorry about that. I had a phone call. And I didn't want to really delete this entire video. You have to start over if you don't pause it. So cervical cancer. So it's common in women between ages of 30 and 50. And one of the risks is multiple partners, for one thing, multiple sexual partners, frequent cervical inflammation, STDs, sexually transmitted infections or diseases, multiple pregnancies. And there's several ways to detect it. And one is called the Pap smear. And so most women will get this once they become sexually active. After about, whenever you become sexually active, and for sure by the time you're 21. And usually get it every 2 years. or every year if you have any kind of cervical changes. If they start to see something, they may want to have you have something done every year. So usually every 2 years in your 20s, maybe every year in your 30s, and then if you go and have 2 normal pap smears back to back, they may back it off and have you come every 3 years, and if you're 65, it's every 10 years. So these numbers are always changing, so I hate to give you any hard and fast rules. So talk to your doctor. Some doctors will do it every year regardless, and some will let you go 2 or 3 years if you've had a normal one. But again, that's one of the ways to do it. It's not the most definitive way. There's also a test for what's called HPV. And human papillomavirus, or HPV, is the most common cause of cervical cancer, so you can actually do a test for that. And to prevent it, and I'm a little out of order for some reason, so I'll have to move that in the copy that you get. To prevent it, there is a vaccine called Gardasil, and it's a 3-dose vaccine, and it protects against most types of HPV, not all of them, okay, but it protects against several different strains and some of the more common strains. So having the HPV doesn't necessarily mean you'll never get cervical cancer, but it reduces your risk a whole lot because it does kind of target those that most commonly cause cervical cancer. And it used to be just for girls, but now they recognize or recommend it for boys and girls because boys are carriers. And there's other things that HPV does besides cause cervical cancer. So if you don't know anything about HPV, you might want to go in. We're going to talk about sexually transmitted diseases, and I'll give you some more information about HPV when we talk about STDs later on. And then lastly, breast cancer. It's the most common malignancy and most common cause of death in U.S. women. About 13% of women will develop some sort of breast cancer. And so the way we treat for breast cancer is good old physical examination. So women, you should be doing your breast exams when you're in the shower, laying on your bed. Always feel your breast better than anybody. So feel for those abnormalities, feel for lumps and things like that, and then get a mammogram. And so a mammogram is the most effective way to look for breast cancer. And they'll just do an image, and they will look at a normal breast, and then they'll look for some kind of malignancy. So you need to be getting these done usually around, again, every doctor's different, and recommendations are always changing. But usually your first one by the time you're 30. If you have a history of breast cancer, if your mom, your grandmother, your aunt, your sister had breast cancer, you may want to get one earlier, get your baseline. And again, the recommendations change from every year to every 3 years depending on family history and your previous mammograms. So again, talk to your doctor and come up with a good plan. But make sure you're doing your breast exams, self-exams, and also getting your mammograms at least when you reach 30. Breast cancer, usually surgery, so they can do a radical mastectomy, which is where they take everything, including the muscle and the lymph nodes. They may do a lumpectomy, where they just remove the actual lump, or they may do a simple mastectomy, where they just take the breast tissue. In all these cases, they may go back if the lady wants to, the woman wants to have breast reconstruction, because you may want that for your clothes to fit right and just to feel normal, I guess. But some women don't do it. They wear prosthetics or just don't worry about it. So again, breast reconstruction is kind of your choice. And then sometimes, depending on how severe the cancer, you may have to undergo radiation or chemotherapy. All right, so I think that's it. And so I'm going to finish doing some more videos. We've got a lot more to go, and then we'll be done with reproduction. Thank you for your time.